Hey, I'm Corey.
And I'm Zakiya.
And welcome to our podcast series called
Fight the Swell.
That's right. This podcast will cover all kinds of topics related to hereditary angioedema, or HAE. Both Zakiya and I are living with HAE, so who better than us to guide what will hopefully be a very enlightening series of discussions with our guests.
Before we get started, we need to remind you that none of the information discussed on this podcast should replace your conversations with your healthcare provider. Each of us will be speaking directly to our own experience, and your experience may be different. Any questions regarding your health should be directed to your healthcare provider.
Okay, today's episode is called Managing Relationships and Intimacy with HAE. This subject might be hard for some people to talk about, but fortunately, that's not the case for us. Zakiya, who's going to be helping us with this topic today?
Today, we are so excited to welcome Brooke to the show. Brooke was diagnosed with HAE in 2017 and lives in California with her husband and daughter. Brooke, welcome to Fight the Swell.
Hi, friends. Thanks for having me.
So, Brooke, you and your husband had just started dating when your swell started to get really bad. What effect did that have on your relationship and intimacy?
So Joey and I, my husband, started dating. That was when I first started showing symptoms and starting to get a little more unwell, I would say. The symptoms started affecting my life. And so pretty much at the very beginning of our relationship, I started to get sick. And he was actually the one that directed me towards finding a diagnosis. But it impacted like our intimacy straight from the beginning. As I started to swell more and more, I recognized that I was starting to have swells being intimate. Our relationship turned into like a caregiver-patient relationship, which was really hard, especially when you're a young new couple. I was only 23 at the time. He was 25. So that was a big change in our relationship. And I started to truly struggle with my body image. I started to look in the mirror and feel ugly, feel deformed, feel disgusting. And it completely took an impact on our physical relationship, on our emotional relationship even. He was here watching, his girlfriend and someone he loved deteriorate, and I was mentally just 100% turned off in a different mental state and feeling like intimacy was the last thing I wanted. It was causing me pain, it wasn't comfortable, and I didn't feel sexy.
Yeah, I definitely can say semi-relate to you. I'm getting married in just a few months. Only less than 2 months. And, I've had the conversation with my fiance about the swelling and HAE and all that comes along with it. And there are times, you kind of get those thoughts like, if I don't like how I look, you know what I'm saying? Like, how do I expect, my fiance to still love me, still care about me, especially when I'm having those really hard mental days?
Exactly.
And, just to know that some of the similarities there is kind of like, I'm not the only one, because intimacy is such a hard topic to talk about, whether it's HAE or, really anything. A lot of people don't really talk about intimacy and relationships and, dealing with medical issues.
Not at all. And I totally agree. I think that the hard part too is intimacy is such a big part of a relationship. And oftentimes we look at intimacy, like everybody's love language is different. So everybody looks at intimacy in a different light. And I think that was the hard part too, is like, not only was I struggling so badly with my body image and like how I felt and everything like that, like his needs and the way he felt was being affected by it too, because it was turning into, is she not into me? Does she not enjoy this with me? Is this not something that she wants? And it had nothing to do with him. It was all me. But then it even turned into an insecurity of his of, okay, am I going to hurt her? Am I going to make her swell? Are we going to end up in the hospital with one of those crazy, ER stories, sex sent me to the ER and or something like that. So it was constantly of us trying to play it off, But then our own emotions, he was being heavily affected watching his loved one sick. But then on top of it, wondering, I don't want to say his worth, but how I felt about him. He started to question it.
Yeah. I can understand and relate to that as well. My outward swellings didn't start happening until after I had my children. And so I went from, trying to have a child with my husband and then having these swells, and our intimate life stopped drastically. That was a big thing for us, trying to work through that and get through the impact that the health issue had with dealing in our everyday life, even that intimate side of things. So communication is so important to a relationship. Brooke, how did you explain your symptoms, not only physical, but emotional, to your husband?
One of the things that was like the easiest thing for us that we kind of came up with is like for my swells, one thing we noticed is if I'm getting ready to swell or I'm starting to have a swell, like one of my pre-symptoms is anxiety or irritability. Like I'm real cranky and snappy and just, as my husband says, nothing's right. And so we kind of turned it in to a joke and we came up with the name Helga. We call her the HAE Troll. And so when I would start to get that, it was kind of like our lighthearted way of communicating physical symptoms. Like, hey, Helga's in the room today. Hey, Helga's hanging out with me today. Or he would be like, hey, Helga seems to be joining us today. Like, are you going to treat or whatever? That kind of opened up the conversation and made it lighthearted for us to start to discuss more of me being like, as much as I want to go with you today, babe, to the barbecue, like I can't, I'm too sick, I'm not feeling good. Explaining to him what the emotional impact has had on me, that some days it wasn't so much I was that swollen, but I was so frustrated with my body that I was almost depressed, and being able to explain to him that although I'm not swollen today and I want to go out with you, I mentally am not there because I was dealing with it all, and be able to, have those conversations.
Yeah, I totally get that. I too get very witchy right before a swell comes on, and my husband is very good about pointing out to me, hey, I think it might be time that you treat, because it's something that we have learned as well. That is a major symptom of mine. Before I swell, I get pretty Helga-ish as well. So I like that. I'm going to use that, I think.
So speaking of communication, Brooke, how do you work through those issues that impact your intimacy?
It took us a while, and thank God I have a extremely patient husband that worked with me through it all. But I think the biggest thing that we finally sat down and actually talked about, and that I kind of made it my goal, was to find a way to show my husband that type of appreciation, just different things in a different way. All those things that intimacy kind of offer an individual, where it makes you feel, that cloud nine, like, oh, wow, like, he finds me so sexy, or he does all this stuff. Finding ways to do that for Joe that would offer him those same type of boosts, those same type of compassion and love when the intimacy couldn't be there. I would plan massages and things like that. It was intimacy in another way. I guess we had that a little more emotional intimacy, and it really actually taught us both that intimacy goes so much farther than physical, that physical is just an aspect of it. It actually even helped our physical intimacy at the same time.
When we hear the word intimacy, a lot of times we automatically think about sex, and intimacy isn't always sex. Like you mentioned, sometimes it's the emotional connection. It's kind of like finding ways around, like when you can't have sex, to still be affectionate with each other. Sometimes even just playing your favorite game, like that's a moment of intimacy that most people wouldn't think, oh, well, that was an instant moment. We were just playing games. No, but if the lights are dim and stuff like that, you can still have conversations over cards. You can still have,
Totally,
those
I
little
agree.
soft rubs, light the candles, set the mood, even though we're not in the space to, be that physical intimate, there are still other things that you can do to still try to value the worth of your significant other.
Yeah, I think another thing that is, for me, what I have found to work is, taking advantage of the times that you have taken your medication and are able to participate in things and know that you have the medication still in you, so you can be physical or have those moments without having to worry about a swell. For me and my husband, that's helped us a lot. We kind of have a running joke at our house is if he sees me taking, if I have to take my medication and he sees it, he's like, oh, great, we've got a few days to do something. So it's something that we take advantage of. And it's something that's taken us a long time to learn that, but it definitely helps.
Oh, yeah, it's so funny, too, because now that I'm, been doing so much better recently and like have a better control, when I do treat, my husband always gives me like the eyebrows and he's like, so, we're going to make up for lost time. Like, what's up? And I'm like,
he sounds like my husband.
Okay, honey.
All right. So what do you think is the hardest thing for partners to understand about HAE's impact on intimacy?
Oh, I think that the hardest thing is most definitely the fact that partners don't always recognize like that HAE could be the cause of the lack of intimacy. So like going back to the whole like internalizing things like I'm not good enough, she doesn't want me. I think that has been the absolute hardest for Joe and I is that explaining, although he knows that HAE has a part and when he really thinks about it, like truly recognizing that like, hey, I don't feel good today, or, I might not look swollen, but I'm feeling it. I'm feeling it today. I'm not feeling good. I'm not 100%. So I don't have the deformed lips or, my stomach, 9 months pregnant, or those types of things, but I'm 100% in that feeling, under the weather mode. And I think it's hard for him to remember that it's HAE that's causing it for me. And that's really hard for a partner to understand.
So, Brooke, in what ways has HAE brought you and your husband closer together?
So HAE has been a part of our relationship since the very beginning. And so we've had to learn all of it together. He watched me from going from this, extrovert that would go out and hang out and always down for an adventure, always down to go hiking and fishing and all these things we loved together, to barely being able to pull myself out of bed. And so I think that caregiver role, that every doctor's appointment, all those things, it's taught us how to love each other differently, that it's a slow and steady long distance race. We can get through anything together. And sometimes the race is faster paced and sometimes we're a lot slower, but we can do anything together.
All right, Brooke, thank you so much for the very honest discussion today.
Thank you so much for having me, guys. I really appreciate it.
And thanks to everyone listening. This is our last episode for now, but hopefully we'll be back again for more episodes of Fight the Swell.
Until then, bye everyone.